Yeah, so the President trial has been a long time in the making. It's a trial of surgery for low volume metastatic hormone-sensitive prostate cancer. Myself and others, when I was in Sweden and in Oxford, did a lot of epidemiological observational studies looking at the role of surgery for metastatic prostate cancer and showed perhaps there might be a signal for that. And then, of course, Stampede published its arm comparing radiotherapy with standard of care and showed a benefit for radiotherapy on top of systemic therapy for low volume metastatic hormone sensitive prostate cancer. So we then performed a pilot randomized controlled trial called Trombone, which was published in the British Journal of Urology International a few years ago, that showed it was feasible to randomize men with low volume metastatic hormone sensitive prostate cancer to standard care versus standard care plus surgery. We also showed reasonable quality of life metrics, outcomes for those men that underwent surgery. And we also showed not only was it feasible to randomize, they didn't have much more in the way of complications than a cohort having surgery for standard indication for localized prostate cancer. So we were able to demonstrate that from a pilot study that there is a need for a full trial, and that men would be willing to participate in a full trial, and a full trial would be safe, it would be feasible to do these surgeries, it would be safe to do these surgeries. And we also did some quantitative investigations, interviews with patients and others that showed that actually men wanted such a trial to investigate surgery and not just have the only option for their local treatment being radiotherapy. And so on the back of all that, we've been very persistent, and we've been successful to the tune of £3 million for a Department of Health NIH grant from the UK for £3 million to run the President trial, which is a full randomized controlled trial on 25 plus centers with 749 men, randomizing between standard of care systemic therapy versus that plus radical prostatectomy to remove the prostate. So that trial will take about 8 years to do. It will be a UK-wide trial, involve, as I say, many, if not most, of the robotic prostate cancer centres within the country, including sites in Scotland and Wales and England. And we hope that it will provide, well, it should provide definitive evidence, level 1 randomized controlled trial evidence about whether surgery on top of best systemic therapy improves outcomes for men with low volume metastatic hormone-sensitive prostate cancer. And we have a composite endpoint of not only survival, but also quality of life, because of course quality of life is very important for men with metastatic prostate cancer. There's no point increasing their lifespan if they're going to have a much worse quality of life for that increase in lifespan. So we have a composite endpoint of quality of life as well as a cancer control outcome. And the other thing that's perhaps different to other studies out there in metastatic prostate cancer, including Stampede, would be the fact that we are using PSMA PET, a novel imaging modality, to future-proof the study, because of course we know that's a much more accurate measure than the kind of standard care in the UK of CT and bone scan. And so all men will have a PSMA PET scan to define eligibility for the trial, and they'll also have PSMA PET scans to look for disease progression throughout the trial. So it's sort of like a state-of-the-art imaging modality that we're using in the trial as well. Yeah, I mean, I think it'll have a huge impact on clinical practice, not just in the UK, but worldwide. I mean, this should be the world-leading study for looking at surgery in low-volume metastatic hormone-sensitive prostate cancer. So let's say in 8 years' time or whatever, we have positive results and show a benefit for surgery. The good news is that our trial is generalized across the UK. So it's not just being done in sort of ivory tower centres in London or Oxford or Cambridge or whatever. We have it up and down the country. And so the surgeons will have developed the skills to do these operations up and down the country. And so we would expect it to be very easy to roll out up and down the country. The other thing about the trial, which perhaps is different to previous surgical trials in the field of prostate cancer, is that we're going to expect 30% of the participants, of the patients, to be from the Black community. And so it'll be a much more representative trial for for Black men who are generally underrepresented in prostate cancer trials, especially surgical ones. And of course, we know Black men are far more likely to develop prostate cancer and have worse outcomes stage by stage and grade by grade because of differences in access to healthcare, etc. So we've been very cognizant of that, and we've been very very keen to make sure that we have good recruitment. And actually, we picked sites based upon a lot of the sites in London based upon having high levels of Black populations that they serve. So we are hopeful that if the trial is positive, it will be generalizable across populations up and down the country, across the world, and regardless of ethnicity.